Hi, this is Mary, and I am here today with Chris Przybyszewski from US Biologic. Chris, welcome.
Thank you so much. Great to be here.
Great. So I think can you just introduce yourself? Tell us about yourself and what you're up to.
Sure. Yeah, my name's Chris. I'm the president of US Biologic, Inc. We are a biotechnology company located in Memphis, Tennessee at the University of Tennessee Health Science Center campus. And we are a company that focuses on pandemic and endemic infectious diseases. Among those, we really do focus in on vector-borne diseases, and primary among those is ticks and Lyme disease. Lyme disease, as you're well aware, is the number one vector-borne disease in the country, about 500,000 people in the U.S. alone every year. It can cause really terrible long-term health problems, neurologic, arthritic, cognitive. It can even be fatal in some cases. And so we're taking a little bit different approach. We understand, everybody understands ticks give us Lyme disease. But in most cases, people don't understand that ticks are actually infected by feeding on already infected mice in the wild, in your backyard mostly. And it's that tick and mouse exchange of the Borrelia burgdorferi, which is bacteria that causes Lyme disease. That's where we focus. And so our first product is a pellet that actually inoculates the mouse against Lyme disease. It's a pellet that inoculates the mouse against Lyme disease. And the simple idea is that if a mouse is not infected, it cannot pass that infection to a feeding tick. And then if a tick's not infected, the tick can't later infect another animal, including humans. And we put it into areas that are, there's the most mice, the most ticks, and the most humans. Usually it means about an acre or a half-acre basis, and it means into people's backyards through different mechanisms that we can talk about. And then we work with our partners in the pest management field. They are the ones, there are licensed technicians who are trained on the application of this product. And final point is the product is licensed by the USDA, and then also conditionally licensed by the USDA, and then also permitted in each of the states where we are right now.
Okay, so so from what I'm understanding, these pellets are distributed. Is it mostly homes right now, or is it also commercially, like in parks or that type of
Sure.
thing?
Yeah. Right now, there's an application through what we call the LymeShield station. So we put this into the context of integrated tick management. So there's a LymeShield system that includes the time application station, the pellets that inoculate the mice, and then also all of the standard tick control programs. We want people to control for ticks. We want people to control for rodents. We want deer exclusion. We want to have people still doing tick checks. We still want people to have education and doing all those things, personal protection, everything that they do. It's essential. We're adding in this new layer where these stations have a small number of pellets, and they only make about 100 pellets available every 2 weeks over the course of a 3-month period. So it's a very small amount. The station really does exclude anything except the smallest of the creatures, the mice, though 1 or 2 other small mammals might be able to find their way in there. And that allows the pest management professional to refill it 4 times a year. And so you get a year-round distribution of these pellets. The mice are feeding on it all year round, even in the snow and the rain. And, it's a really great system that does its best to protect the pellets across that time.
Okay, and I sidetracked you there too. So basically, these pellets are out there. The mice come and eat the pellet, and what is in the pellet basically doesn't allow the I can't say it.
The Borrelia burgdorferi.
The Borrelia burgdorferi to basically kind of grow within the mouse.
Yeah, that's right. Absolutely. It's a simple dead protein is what it is.
Okay.
And it causes, and that's important. This isn't something like a virus. This isn't something like a live bacteria. There's no living aspect of this pellet. It's a dead protein that when it gets inside of the mouse's intestines, it tells the mouse's body to create antibodies against Borrelia. And that's it. So it acts just the same way as any other technology like it. And it just stimulates the mouse's body to create these antibodies, and the mice are then inoculated against Lyme disease, as it were. Also, there are no active ingredients. There are no chemicals here. There are no poisons in this. We're not killing the mice. We're not killing the ticks. This is something where it's a very different process, and it works very naturally with what the mouse's system does already.
No, it's just to make a sidetrack. It's interesting. I was talking to someone recently about malaria, and they're doing a study in Uganda. Basically, they're putting in for children. They're giving them these like long-term chemo preventions that will basically it keeps them from not getting malaria even if they're bit by a mosquito. So they found if they can reduce the amount of kids that have malaria, it reduces like everyone having malaria, because then there's less ticks.
Yep.
I mean, there's less mosquitoes that
That's right.
can pass malaria. So it's a similar, like the less ticks there are in the whole community that are carrying these parasites, then less people that are bit. Or if people are bit by a tick, it's a tick that's not, that's the whole key. It's being bit.
That's right.
If you are bit by a tick, you want a tick that does not carrying these germs.
Yeah, all ticks are dangerous, right? They're awful. So, but what we're able to do is reduce the number of disease reservoirs, the mice.
Exactly.
So they're called a disease reservoir because they don't have Borrelia doesn't matter to them. They don't get sick with Lyme disease.
Right.
They don't have symptoms of Lyme disease like humans do, but they do carry the bacteria. So we're reducing the number of those infected mice, which means that we're going to, our field trials show a 76% drop in infected ticks, 76% drop. And, so those ticks are feeding on those mice that have been inoculated. They're not getting infected. And there's your impact overall. Right. But really, it is the focus on the mouse. We are inoculating those mice against Lyme disease.
No, yeah, it's such an interesting new way. So actually, I was going to ask about the study. So obviously, to get any approvals like you've done, like we know for EPA, you have to prove and show a lot of data and do a lot of testing, and you have to be able to do it over and over and over,
That's right.
like any scientific thing. So what did you, when this was developed, how did that come about? Did you have the pellets? Did you have other ways to do it? Was it always like, let's get this pellet system? How did it evolve to this?
Well, it's been an evolution. The original inventors were Maria Gomes-Selecki and Luciana Richer. And Maria Gomes-Selecki, they're both veterinarians and both microbiologists. Maria is an associate professor at the University of Tennessee, and Luciana is our laboratory director and one of our principal scientists. And over the course of several years, they created in the laboratory this edible form of a vaccine that showed to be, substantially, protect these mice against the infection of Lyme disease. And then they performed a 5-year field trial with the Carey Institute of Ecosystem Studies in Millbrook, New York. And this is where they systematically put the baits out, and they were a little bit different form. I'll tell you about in just a second. They would put these out every night. The mice would eat them. They would capture the mice. They would test the mice, safety check, all those kinds of things. And then they looked at it year over year, and they saw a 76% drop in the number of infected ticks in certain fields. This was a handmade cookie. They had oatmeal, and they just literally had to do this every single night, hundreds of these every single night, because it couldn't last very long. It still had to be refrigerated and all those other things. And so after that time, and by the way, that was about $7 million of an investment from the NIH and the CDC. So there's a major investment by those agencies. So when we got a hold of it, then Maria had found these things, and she said, "Look, I've done what I can do on this. Now it's time to start a company." And so she helped co-found, along with 4 other folks, myself and the CEO, and 2 scientists from St. Jude Children's Hospital here in Memphis, Howard Hughes Medical Institute scholars. And, we had a lot of challenges. We had to create something where we could make 1 billion doses, have them be made incredibly cheaply and incredibly fast. And so our method was to buy pellets from Purina. Purina made for us these really non-nutritive pellets. They have very little carbohydrates in them. They're very, very hard, just like an acorn. They're beveled, just like an acorn, because mice like to hold on to it and eat from the outside in, kind of like we'd eat an apple. And so we spray coated those pellets then with the vaccine, and with with a couple of things that would protect the pellets as it would protect the vaccine as it would go into the animals. and protect it through the gut of the animals. And that's where we saw the inoculation happen. So you make all those things and you say, okay, we can manufacture it now. Now we have to see that it works in the field, right? We have to know that it actually works. And so we then partnered with the Connecticut Agricultural Experiment Station and ran a 3-year trial in Reading, Connecticut, people's backyards. And that's where we showed the same 76% drop in number of infected ticks. So it was at that time we said, now we're ready to go into the USDA licensure process. Now, USDA focuses on purity, potency, efficacy, and safety. Those 4 things. It's always those 4 things. And we had to go through a number of very rigorous laboratory trials to prove every single one of those. For example, on the safety program, we had to inoculate just hundreds and hundreds of mice. And we had to watch them over a period of several weeks, and we had to make sure there were 0 adverse events. The mice were not sick. Nobody died. They didn't stop eating. They weren't hunched over. It looked like they were in some sort of distress. And, we had to perform that full thing. We then had to do an efficacy trial where we had to really, we inoculated the animals, and then we tried to infect them with Lyme disease. And we took a needle and we just put in an enormous amount of Borrelia into the animals. Okay, there's far more than they would ever see in a tick, or a number of ticks. I mean, we just had to see that it worked, to push it as far as we could go with it. And we protected 65% of the animals that were vaccinated, which is a good number for us in the wild. And so, and then along with that, we did purity and potency, which basically just said it's exactly what we said it was. There's no other elements in there. We had to prove that step by step. And we had to show that we could manufacture it at scale the same way every single time. So the regulatory process is very, very rigorous. It's very unforgiving. USDA has been great. We've been working with them every step of the way. But it's founded in 2012. And it's been 12 years, and we got on market a handful of months ago in July of 23. Yeah. So it's well, thank you. Yeah, it's a process though.
Yeah. Yeah, we know from the EPA too, because it's we're on the other side, but similar.
Yeah,
I think it's important that people understand, if in this world, if you're making claims like this, they have to be backed up. And there's many things out there that are naturals, which I'm sure absolutely there's some that work and there's some that don't. But what I often say to people is the one thing with anything that has a registration, like from a USDA, an EPA, or an FDA, that they had to be proven, and these claims are all backed up by science. And there might be certain things you're buying on the market, and it says, a natural. No one's checking to make sure what's in there is what the label says. Yeah. So I think that
it's essential. Yeah, it's absolutely essential. From our perspective, it was safety first, and then did it make an impact? Right? Is it safe? And then does it matter? Right? Exactly. And so the safety piece. We did the regulatory piece, but we really took it a couple steps further. 8 years of field trials, we never saw any adverse events. We never found any mice. You would trap a mouse and you would check its blood and you would check the ticks on the mice, and then you would let the mouse go because we want them back in the environment. We want them to be able to do what they're doing. We never found any dead mice because of the pellets. We also then, and of course, we never found any birds or foxes, any of the natural predators. We never found anyone that was distressed or anything. We took another step further and we put it into 36 beagles. We wanted to really put it into them and see what would happen in an off-target species is the term.
I was going to ask you about dogs, because I would think many people would be just making sure that in their backyard, their dog is not going to have.
Oh, absolutely. Yeah. And they should have questions, and they should ask questions. They should demand this information from anybody, certainly us. And so we put into these dozens of dogs, and we looked at them for a long time, and we said, how are they looking? There are so many things. Are they feeding okay? Is their stool looking okay? Do they have any other, impact, fevers or anything you would normally see? And we saw it was all safe. We saw no adverse events again. These dogs were in such good shape. We are actually allowed to get them adopted. Usually when you do a dog study, and if you make them sick or distress them, you usually have to sacrifice them for humanitarian reasons. In this case, the USDA examined the veterinary reports and said they're fine. Just go ahead and give them away. And we were able to find them all homes, which made us pretty happy. None of us wanted that. So they're out in the wild, as it were, but those are different people's homes and stuff.
So actually, so are mice attracted to the pellets in a certain way? I mean, is there concern that like a fox is going to come eat all of them and before the mice get to them? How does that work?
That's a really important question. And there is no attractant on these pellets. There's no meat smell. There's no fish smell. There's no sugar smell. There's really nothing. And the mice they really do a great job on consumption. So we did a study where we went out into the field and we put the pellets out there and we put a biomarker on it. And then we trapped the mice around there. And what we found were in the stations, about 80% of the mice in that immediate area ate the pellets within 48 hours. So those mice went out there and they found those pellets over and over and over again, and they consumed those pellets at a really high rate. When you did a simple broadcast where you would broadcast the pellets freely out into the field, 90% of the mice found it. So they actually found it better when you were just randomly, broadcasting it out in the station. We found raccoons were an interesting thing. And so one of the earlier versions of this, the station itself, it allowed the raccoons to get on their side and reach under the station. We have nighttime cameras that were showing that. So we built the next version of the station actually has raccoon guards in it, so the raccoons can't get into it. Now, don't get me wrong, a raccoon could shred it. Okay, they could shred a metal trap if they wanted to. Right. But there's no meat smell in here. There's no fish smell in here. They don't care that much to spend that much energy. Right. They know the pellets are in there. It's just easier to go to a garbage can, right, or something of that nature for them. And so that's why we have very little animal interference. And the stations themselves are actually on a 20-pound paver stone. So it's not like a dog can't nose it up. Okay. That's what we saw earlier when we had just stakes in the ground. The dogs would get under it and push it up, and so we got a lot of stations that were at 45-degree angles. And so that's when we started putting them on paver stones. So now the dogs cannot interfere with them either. And so it really does limit the types of critters that can get in there and get to those pellets.
No, it's great. And I think one thing that's important, mice are important in our ecosystem. It's funny, I asked another Lyme expert one day and I said, are ticks important in our ecosystem? He was like, no. We think they're involved.
I haven't met anybody who can tell me. Yeah.
Right. So, I mean, and even that's for some mosquitoes too, because mosquitoes do have a place because other, like maybe other, they get eaten and so they're a food source. Ticks seem to have no purpose anymore. Maybe they did at some point. But I think it's important because we do need mice to control other, within, especially in our backyards, we're all getting closer to nature. We don't want to just eliminate mice because then other things would take over.
No, you're right. And people ask me a lot, why don't you just kill the mice? If you have a pellet that so many mice can get to, just put a poison on it, right?
Right.
And the answer is actually really simple. It's because it won't matter, because other mice will enter that territory. Mice are territorial. They're just like a lion. They have their area that they defend. And it's not about it. We count it on an acre by acre basis. Obviously, mouse doesn't care what an acre is. But we count it on an acre by acre basis, and we know there are about 20 mice in that acre. In general, it'll be anywhere between 5 and 20 mice in that area. And so, if you killed all the mice, new mice will come in. So what we do instead is inoculate those mice in that area, have them passing out those antibodies to everybody, all the ticks, have them running around generating those antibodies. We're basically making little mobile biomanufacturing facilities for the antibodies against Borrelia burgdorferi. And we want them then to maintain that ecosystem, because that's where you're going to get, that effect you were talking about, where the less infected, animals you have, the less infection spread you have, which just makes sense.
Okay, almost wrapping up, but what happens when the mice have babies? Is there any pass along?
Yeah, so we don't have any claim on that. We only talk about inoculating mice with our pellets. Now, what we have seen in the literature, though, with other people using a Lyme vaccine in different ways, what they did was they inoculated the female mice. They were able to impregnate those mice, and those mice had pups. And they did see that the pups had raised antibody levels against Borrelia and could be protected for a short amount of time. So we have seen that. Again, that's not our pellet. We don't make claims on that. But when you look at the scientific literature, that has been observed in the field. And that's cool. That's really, really neat, because, again, the maternal antibodies are not a new thing. We've known about these for a long time. They're enormously important across multiple species for birth rates and being able to have survival rates. But at the same time, we have seen that impact here. So it's a cool mechanism.
Yeah. No, it's yeah. You think about what it could do long term, and as the years and years, and how it could the more it could really dramatically reduce the amount of ticks that are carrying the germs, and just how the snowball effect to people and health, and no, it's really cool. So, how do people? What if someone wanted to use the pellets, get their yard? Because again, like at Insect Shield, we believe there's many parts to the world of protecting yourself and your family from ticks.
Yes.
So we love that this is a new way people can protect themselves, and especially in their own space. And I think people often forget about their own yards. They're thinking, oh, well, when I'm going on the trail, I'm going on the hike, I have to worry about ticks.
Right.
But actually, I think yards are high up there for people being bitten and getting potential diseases.
Yeah,
so
absolutely.
You to get this
LymeShield.com. Yeah, LymeShield.com. LYME Shield.com. And you'll see some more information about it. And you'll see all the pretty pictures. And then when you scroll down, you'll see a contact form at the bottom. And if you reach out to us, we will get you in touch with a local pest management professional who's been trained and who is certified to sell and apply these. And that's really the only way right now to do that. That's the licensure process. This is a licensed product for that, like any other pest management product. And so we'll set you up in those states where we currently have permits, and we'll let you know if that's the case. So
okay, excellent. And we'll put a link to that at the bottom of the interview.
That's great. Thank you.
My last question: is there a myth about ticks that you would like to debunk for us here today?
Deer. It's really about the deer. I think a lot of people, the majority of people I've met over the years, they believe that deer are the main purveyors of Lyme disease to the mice. I'm sorry, to the ticks. And so they ask, why don't you just inoculate the deer, right? The reality is that deer, the major role of the deer is where the ticks propagate. That's where they go up and they mate, they lay the eggs, and the next generation is born. And then as larval ticks, as baby ticks, they fall to the ground. And that's where they found a mouse that's infected, and that's when they get infected. So the deer are very, very important for the number of ticks that we have. And we have exploding population of deer. You're now having an exploding population of ticks, right? I mean, that's just to be expected, but they're not the source of that infection. Really, they're not. It's going to be about the mice predominantly, about 90% of the time. There are some other squirrels or birds, that sort of thing. But in the Northeast and the Midwest, where Lyme disease really happens in the U.S., that's what the animal is that mouse. Over in California, where they do have different species, but even then, it's Peromyscus leucopus, the white-footed mouse, or it's the one of the rats that they have out there. So but the deer, all about the number of ticks, but it's the mouse about the infection of the ticks.
Okay, and I do have one more question I just thought of.
Sure.
Are you all potentially working on this for other tick-borne diseases and germs?
Yeah, that is a great question because ticks pass over a lot of diseases, right? We do have Lyme is the most prevalent, but there's babesiosis, there's anaplasmosis, there's alpha-gal, all these different pieces. Our solution to that is actually an anti-tick vaccine that we're working on. This will go right alongside the Lyme vaccine. And this actually will reduce the number of ticks by making it more difficult for those ticks to reproduce. And so we're working on that in the laboratory right now. We'll be entering field trials soon. And we're going to roll that out and talk about that more as we make more progress. It's very exciting.
Yeah, it's so cool. And it's really interesting you're coming at it from such a different side, which is wonderful because, there's a lot of the repellent world and just protecting yourself and your family. But to say, okay, it's the animals that it all starts from. So let's go to the beginning and get that, kind of see what you can do there. So it's really cool. And we're thrilled to kind of tell what you guys are up to. And we'll keep an eye and hopefully.
I appreciate that. If we want to get serious about infectious diseases, we got to go to the source. Really. And we have to have diagnostics for humans and treatments and, vaccines for humans, like absolutely. But if we're actually going to be serious about it, this is a harsh statement to say because it makes it sound like we haven't been serious. But if we're actually going to be serious about it, we got to go to the animal source, and that's where we are. And we're spreading the good word along with these pellets that inoculate mice against Lyme. So
Okay, well, wonderful. Well, thank you so much for joining me
Thank you.
today, and we'll be watching you. Thanks.
I appreciate you so much.
Okay.
Have a great day.
Okay, take care. Thank you.